scaling can be done because he is going to require radiotherapy in advanced cases. Patient of a hemimandibulectomy requires other things like guide plate prosthesis, and a maxillectomy patients require dental obturators. So obviously, you are more experts than me in this field. Patients require no malignancy treatment is one-time treatment. Patient requires a regular follow-up and early detection of recurrence, which can happen in advanced cases. Almost there is a 50-60% chance of recurrence. So again, patient is coming back to you for follow-up. Early detection will always give better results. So we will be the ones who will be detecting these recurrences, so we can treat these patients.
Sir, about diagnosis.
Yeah.
Now, basic graduate, dental graduate.
Yeah.
See, making a diagnosis and disclosing the diagnosis to the patient.
Yeah.
May hurt him psychologically, and where the dentist he himself gets hurted by medical legal aspect of it.
Yeah.
So, what are the limitations and what are the ways to diagnose the patient and reveal the diagnosis?
No, see, I'll tell you one thing. Sometimes I have realized that not making a diagnosis, or sometimes dentist has made a diagnosis, but if he has not revealed it to the patient, that sometimes causes more problem, because then patient doesn't take it that seriously.
So we can't be 100% sure.
No, but at least some kind of this thing that I'm suspecting something, that should be put in patient's mind. Otherwise, patient doesn't take. See, what happens is that the dental problems, people don't take it that seriously. He said, okay, I have gone. Dentist said that there is some problem. Okay, when I have some, when I take leave, when I'll sort out other problems, that time I'll again go back and sort out.
I want to protect my community.
Yeah.
Dental surgeons community.
Yeah.
So we are on the borderline. We can diagnose it.
Yeah.
Not to 100%, but to some extent.
So if you have a, when in doubt, yeah. When in doubt, you say that there is a kind of some degree of, I want to take another opinion, and let a kind of a head neck surgeon.
To what extent we can investigate? Up to what are our limitations for investigation?
See, there is
MRI.
Yes, absolutely. There is nothing wrong in getting investigation. There is no this thing. In a sense, doing a biopsy or getting a this thing done, MRI done. Okay.
Having a fear of metastasis and
doing a biopsy does not. That again, there is a wrong concept that doing a biopsy will spread a disease or this thing. No biopsy leads to spread of disease. Period. See, what happens is that a patient will blame a doctor that he has a malignancy. A biopsy leads to diagnosis of a malignancy, and the doctor gives him that diagnosis. So finally, it's like a shooting a messenger. That he's told me this malignancy, so he's a bad man. He had this malignancy in his body. He was sitting at home with the diagnosis, with the malignancy. Doctor did a biopsy. He gave him a diagnosis that you have a malignancy. So malignancy is not bad. What tobacco you were chewing for 30 years is not bad. But doctor told him that he has a malignancy, so the bad man is the doctor who gave him a diagnosis. So that's what happens. And what doctor ने biopsy किया इसलिए cancer हो गया. That's what people come and told us regularly. कि मेरे को कुछ cancer नहीं था, doctor ने biopsy किया इसलिए cancer हो गया. This is what regularly people tell us. But see what happens is nobody wants to blame himself for whatever has happened to him. Finally, the blame has to be put to somebody given.